So addiction is a primary brain disease. By primary, it means when a person has addiction and 2 or 3 other illnesses, say they have depression, say they also have bulimia. When I say that addiction is primary, if they have co-occurring illness, their addiction is primary, their bulimia is primary, their trauma, PTSD is primary. When a person has addiction as a primary illness, it doesn't mean that their addiction is caused by their depression. Like, well, if they weren't depressed, they wouldn't drink anymore. Not everybody who's depressed experiences relief of depression when they use alcohol. Patients who have addiction to alcohol may experience that when they're depressed. So addiction as a primary disease also means that it's not caused by substances. This is surprising for many people, right? Many people think of addiction and they think, well, drugs cause addiction or alcohol causes addiction. Addiction is a primary brain disease. Addiction is caused by underlying predispositions in neurocircuitry involving reward circuitry, in our genes, the genes that mediate things like the amount and the function of dopamine receptors that we have in our brain. Probably many other genetic factors that we're not even aware of yet. So those predisposing and primary aspects of addiction load the gun, and exposure to not only substances, but adverse life experiences, to social inputs, to media, to culture, all serve to pull the trigger on somebody who eventually develops addiction. So there's a pretty significant distinction between addiction, which is a brain disease, and somebody using a substance.